Hello everyone, this is Dr. Indhumathi Kuberan, consultant diabetologist from Mumbai. Welcome to my channel, Diabetes Eye Openers with Dr. Indhu. I'll be sharing clinical pearls from my day-to-day practice so that awareness among the people is increased. So today I will be basically talking about the types of diabetes. Most of us know there are two types of diabetes. One is type 1, which mostly people think it happens in young, but it also can happen in the elderly. Type 1 diabetes means the pancreas does not produce insulin, and such patients have to be put on insulin. Insulin is the only treatment for them, and they have to take 4 to 5 shots per day. 3 shots before meals and 1 shot or 2 shot after meals. And they have to take it every day to be alive. Today I'm not going to discuss about type 1. The second is what we see day to day in our practice. 90% of the people who walk into our clinics with type 2 diabetes, and mostly it is fueled by excessive eating and sedentary lifestyle. And believe me, trust me, 50% of the type 2 diabetic patients can be managed with diet and exercise alone. They don't need medications. But today I'm going to talk about a special type of diabetes which doesn't fall into these two categories. It comes somewhere in the middle. It's called LADA. That is Latent Autoimmune Diabetes of the adult. There is very less awareness even among the clinicians about this very common condition called LADA. To explain this, I will share with you a small example. So this lady was a 45-year-old lady. She came into my clinic very thin. The first thing which caught my eye was she was very malnourished. She was around 39 kgs. Her HbA1c was 14%. She had been to various doctors, and I think I was the 6th or 7th doctor. And when I went through the reports, I saw that historically, over the 15 years, her sugars were poorly controlled. She was on premix insulin, that is insulin which is taken twice a day on very high doses, and also you name it, all the molecules were there in the prescription. She was on metformin, she was on glimepiride, she was on pioglitazone, she was on various other molecules which are now available for the treatment of diabetes. But she was a very unhappy lady. She was a teacher and she was not able to concentrate or give her full productivity for the job. So I asked her about any family history, and surprisingly, there was no patients with diabetes in her family. I asked her about the symptoms, and she said she keeps on drinking water because she's perpetually thirsty. And the visits to the washroom was also very frequent. When I went through the various files which she brought to me, because she had already consulted 6 or 7 doctors before me, I found that one important test was missing. That is called the C-peptide level. C-peptide level means it shows how much insulin is produced by your pancreas. It is very important to differentiate these types, various types of diabetes when you are doubtful by the single test. So I told her, please go and get your fasting C-peptide levels done. She immediately obliged. The next day she came with the report and it was 0.0002. That is, her pancreas has stopped producing insulin. I explained to her that her problem was not, it cannot be solved with tablets. Her problem can be solved only with insulin. She said, ma'am, I'm already taking insulin. I'm already taking 16 units of premix insulin. I said, no, this insulin, premix insulin, is for type 2 diabetes. You're not a type 2 diabetic, you're LADA, and we'll have to put you on basal bolus. Basal bolus means the basal insulin will cover the sugar levels throughout the day, and the bolus insulin we give before meals to cover the food which is eaten by the patient. She was upset for a couple of minutes, but then she recovered and she agreed to go on basal bolus insulin regimen. She understood what she had, and she had also Googled about LADA. So in 3 months itself, her HbA1c came down to 8%. She had put on sufficient weight. She was around 45 kgs in around 3 months. She was looking more healthy, and mainly she could give her full productivity in her teaching job. So When your sugars are not coming down, you're losing weight excessively, you're not responding to high doses of insulin or oral tablets, ask your doctor, request your doctor to do the C-peptide fasting levels to rule out LADA. Thank you.